Thank you for joining us for today's launch of Facing Cancer Together, a region-wide effort to increase our understanding and behavior about cancer. We welcome the staff and volunteers from our partners, associate groups, and members of the press to this interactive webinar. We have some fascinating research results to share with you.
I'm the captain of my ship, I'm the master of my soul, and that's my philosophy. And that's what's carrying me through all of this.
I guess I'm terminal, basically. It just depends on when.
For the first time about 3 years ago, the number of patients dying of cancer actually decreased.
We're in this together.
Good afternoon. I'm Kathleen Pavelko, president of WITF and your moderator for today's Facing Cancer Together webinar. On behalf of WITF, I'd like to welcome and thank all of you for joining us today. 3 of the region's health systems and WITF public media have united to bring in-depth information and cancer resources to the people of Central Pennsylvania. Facing Cancer Together is an interactive community education partnership of Pinnacle Health, Lancaster General Health, WellSpan Health with WITF, plus more than a dozen associate organizations in the region committed to cancer treatment and support. WITF is very proud to be in their distinguished company for this project. Over the course of the next 9 months, Facing Cancer Together will present video, audio, print, and web resources in 6 broad areas: cancer treatment, research and policy, living with cancer, healthy lifestyles, caregivers and family, and end-of-life care. More than 130 multimedia pieces will be produced, including a technologically innovative interactive application that we call the Digital Quilt. The goal of Facing Cancer Together is to convene the citizens of our region on this immensely important and personal topic, to present trusted experts and information about cancer, and to host thoughtful discussions in person, on air, and online. All of the ways that you can connect with us are on the screen right now. You can use Facebook, Twitter, or simply send us email at facingcancertogether@witf.org. Facing Cancer Together is a research-based project with the goals of improving knowledge and changing behaviors about cancer. The Facing Cancer Together project recently completed the first phase of a 2-part research study into what the citizens of our region know, believe, and feel about cancer. Before we discuss the results of that survey, we want to give you a chance to test your knowledge too. If you're joining us on Adobe Connect, you can take this time to answer 3 poll questions right from your screen. Our first poll question is this: treating cancer with surgery can cause it to spread throughout the body. Do you strongly agree, somewhat agree, somewhat disagree, strongly disagree, or don't know? Our second poll question is, there is currently a cure for cancer, but the medical industry won't tell the public about it because they make too much money treating cancer patients. Do you strongly agree, somewhat agree, somewhat disagree, strongly disagree, or don't know? Our third poll question is, the risk of dying from cancer in the United States is increasing. Is this true or false? Go ahead and answer the questions. We'll review your results and compare them with the survey results a little later in the program. In the survey we conducted, we found some surprising gaps in knowledge and some reassuringly high levels of awareness too. For example, 93% of respondents correctly know that most cancers can be effectively treated. And 81% rightly know that even long-time smokers can reduce their cancer risk by quitting. We'll see how you did on the questions in a few minutes. Joining me now in the Greenwald studio at WITF's Public Media Center are representatives from our health system partners. Dr. Ronald Hempling is Director of Oncology Services at WellSpan Health. Betsy Kopp is Director of Cancer Services and Research at Pinnacle Health. And Dr. Randall Oyer is Medical Director of the Oncology Program at Lancaster General Health. Also joining us today is Burwood Yost, who's Director of the Center for Opinion Research at Franklin and Marshall College in Lancaster, which conducted the research we've just been talking about. Burwood, I'd like to talk with you. You've done many surveys in many fields of interest, including many in the whole healthcare field. What are the highlights of the survey results from your perspective?
Well, I think there are a number of things that are interesting. First, related to cancer knowledge, we find that citizens of Central PA are reasonably well informed, maybe moderately well informed is the best way to say it, about cancer risks and cancer knowledge. And their levels of knowledge are about equal to what we would see nationally. So we're not far ahead, but we're not behind either when it comes to what we know.
We're not all above average yet?
We are not in Lake Wobegon at the moment. We do find that knowledge about certain things like smoking and skin cancer tends to be a little higher than other topics that we asked about in the survey. I think what's also important and interesting is that people with health insurance tend to know more than those without. And that can have serious consequences, I think. Another thing that was interesting in our work, I think, is that many people are receptive to the idea of changing their behaviors to reduce their cancer risks. That said, we still have a lot of people engage in risky behaviors. A lot of people still smoke in central Pennsylvania. A lot of people don't get enough exercise, eat too much, and are overweight. So those are our concerns. I think the third thing that really stood out at me for this study is how some of the behaviors in terms of screening are not as high as we'd like them to be. When you look about recommendations for screening for certain types of cancers, not enough people are doing it. And we find once again that the uninsured are far less likely to do those things than those with health insurance.